Hi, Dr. Story. Thought I'd take a moment to talk about pertussis. Pertussis is another name for whooping cough. It's one of the common childhood illnesses that's been with us since the beginning of time. And so a lot of families are comfortable hearing about it, but what you might not be aware of is that it's currently circulating, and we're seeing a fair number of cases here in our community. So I wanted to talk a little bit about what is pertussis and how to be aware of it, how to test for it, and some considerations you might have. First off, pertussis is quite a contagious illness, although it's mostly contagious within households. So whenever we see an illness, it's usually due to close contact with someone that's actively coughing. The challenge is that most people that have pertussis may not know it. The most common presentation for pertussis is just like a common cold: congestion, runny nose, and cough. And that's common, particularly for the first couple of weeks that you have the illness. The classic cough, the whoop cough that makes the noise, really doesn't show up until several weeks to even several months into the illness. But it is one of these illnesses that can go on and on and on. Mostly it's an illness that's hard on certain individuals, particularly infants and children. And that's one of the reasons that for the last many decades we've been immunizing that age group to basically prevent an illness that really labors kids, and for many kids can even put them into the hospital with a severe illness. And when that whooping cough gets severe, there's actually very few treatments other than just trying to get you through it. In our clinic, we're glad to kind of raise the question and talk about it. We are evaluating quite a few patients with an active cough in the parking lot, and then if there is testing to be done, we can do that through our clinic. It is testing that does take a week or more to come back, so it's not a quick and easy answer. In cases where we suspect it, we actually might encourage you to go ahead and treat while we wait for those results, because that's generally good medicine, and it can reduce the severity of the symptoms and the longevity, and also really keep you from passing it around to other people. Biggest picture about pertussis is that we would encourage you to consider immunizing against it. It's part of two different vaccines, Tdap and DTaP. The DTaP is the childhood version. That includes two other vaccines that are commonly given, one for tetanus, and commonly those are given starting at ages 2 months and given in boosters over several times. It's a very, very weak vaccine, and for most people it wears off after about 10 years. So it is the kind of thing that we consider boosting over and over again. These are not embryonic stem cell based vaccines, meaning there's no aborted tissue in them, so we confidently recommend them and give them to our patients here at Story Family Medicine. Again, hope that you have an opportunity, just if you're actively ill, to consider at least limiting the exposures. Talk to your family doctor here at Story Family Medicine. Let us give you good advice.